Good morning. Today we can discuss about sialolithiasis. So first we can check what is sialolithiasis. It is the calcified structure or masses of crystallized minerals that formed inside the salivary gland or duct. The stone, also referred to as salivary duct calculus, is the most common cause of blockage in the salivary duct that prevents the flow of saliva. Next, we can check the epidemiology. The region that is most commonly affected is in the submandibular gland because it's due to its viscous secretion and the ascending pathway of duct. The age group that is most commonly affected are 48 years. Also, it can be seen in people who are 25 to 61 years. The sex which is most commonly affected are males. The causes of sialolithiasis are dehydration, not eating enough food, medications of blood pressure and antihistamine drugs, and trauma. Next, the pathogenesis. The certain substances in saliva, such as calcium phosphate, calcium carbonate, can crystallize, forming stones varying in size. When the stone blocks the duct, saliva builds up in the gland, leading to swelling. Next, the clinical features of sialolithiasis are dry mouth, swelling in face, mouth or neck, pain in the face, mouth becomes worse during males, redness over the affected area, fever if there is bacterial infection, trouble in swallowing food or opening the mouth. Next, the examination. The examining head and neck to check for swollen salivary glands and duct zones. That is done by the bimanual palpation. The imaging test can be also done. The imaging tests provide a more accurate diagnosis because the physician can be able to see the stone. It includes X-rays, ultrasound, computer tomography scan of face area of the imaging test that may be required. Next, we can discuss the diagnosis of sialolithiasis. The investigation methods are X-ray, CT scan, SIALENDOSCOPY, and SIALOGRAPHY. Next, we can discuss each. Conventional radiography. In this, the intraoral radiography includes IOPS and occlusal radiograph, whereas the extraoral radiograph includes panoramic PA skull projections. The main drawbacks of this method are intraglandular and small stones can be missed. Next, we can discuss about ultrasonography. It is non-invasive alternative method. Stones more than 2 mm detected as echo-dense spots with a characteristic acoustic shadow. Next is the computer tomography. In this method, the posterior part of the duct can be seen and any substance of the gland can be seen using the radiation exposure. Non-invasive and do not require any contrast media. Next is SIALENDOSCOPY. It is the minimally invasive method and can be used for both diagnostic and therapeutic uses. It includes a small endoscopic light at the end of a flexible cannula. Next is sialography. In this technique, ductal injection of a small amount of contrast media followed by routine X-ray projections. Next, we can discuss about the treatment of sialolithiasis. Most patients are managed conservatively with oral hydration, analgesia, and sialogogues such as lemon juice, which promote the saliva production. Milking or massaging the gland can help as well. If the gland gets infected, the patient develops siaridinitis. Then antibiotics are typically indicated. For larger stones, SIALENDOSCOPY can be done. It is the less invasive technique to remove salivary gland stone. In this method, an endoscope is inserted into the opening of the duct and a